Hello, my name is JD Henry, and I am the lead chaplain at Keystone Hospice. Thank you to you, the faith community, for taking the time to listen to a presentation about advanced care planning and how the current pandemic crisis has spotlighted the need for us to talk about our end of care or end of life wishes. Depending on where we live, we may or may not feel a different degree of urgency on this matter, but I think it's still important for us to have the discussion about what our wishes are on life-saving and life-sustaining interventions are. So COVID-19 has created a situation where every aspect of life has been impacted. We see churches who are providing spiritual care remotely, trying their best to speak truth and peace and calm into the storm. Medical staff are conversing with each other to learn the latest research and best practices on how to serve the community. So the medical community, along with space in the hospitals and medical supplies, are potentially being stretched thin. Chaplains are having their own conversations along with social workers about how to support them and those who are sick and their families. And every day, chaplains are facilitating discussions around end-of-life values, hopes, and wishes. And individuals are doing their best to practically help in this crisis. You know, you see people who are rallying around local businesses, trying to support them, trying to help. People are making masks. People are trying to spread cheer and goodwill to one another. So what more in this time can we do? And so we thought that one tangible way that you can help both the medical personnel and yourself is to have advanced care discussions within your families and in your doctors to make a plan. So faith communities can encourage these discussions to happen. And with your desires designated in a legal document, medical workers can make quicker, more informed decisions about your care in moments of crisis. So with me in this conversation, I have Chaplain Drew. He is one of our chaplains at Keystone Hospice, and he's on our ethics committee. And we have Dr. Dunay. She is our medical director in Keystone Health. So Drew, you and I, as chaplains, are able to serve people from very diverse religious backgrounds. What is an underlying ethic that can unite us right now?
Yeah, thank you, JD. One ethic that I think that can unite all of us together, regardless of what your religious affiliation is or what our denomination is an ethic of love. So I see three aspects of this without getting into the nitty-gritty of regardless of what your religious affiliation is, and the specific theological viewpoints on each, which we're not totally going to get into, but a unifying ethic of love, to love the medical community, love our family, and love ourselves. So to spell that out, loving the medical community, we often, a lot of us are already trying to do this, whether it be creating masks for the medical community or for ourselves so that we don't take their resources. I know some people are providing other medical gear or resources or even food for the medical community where needed. And so with this helps by having our own desires put down on paper for what we want with advanced care directives. It speeds up their response times, like JD said, and helps them in the decision-making process when we have already made those decisions ourselves. Two, it helps our family members. So there are situations, not just now, but in normal life where we might have an emergency. And if we're not able to speak for ourselves and what we want with the medical interventions, that places the decisions in the hands of our family members. And sometimes that can be really hard if that means our family members are having to decide whether or not to keep us on some type of life support or having life-saving measures. So having that spelled out beforehand saves them the moral difficulty, if you will, of having to choose something and potentially being weighed down by the guilt of whatever that outcome might be with their decision. So it's loving our family members by having those decisions taken care of ourselves. And then it's loving to ourselves. If there are certain interventions that we want or don't want, then if we have that spelled out beforehand, then we don't have interventions that are being done to us that we don't want. And the medical community does not know what that is unless we tell them. And so it also gives us a greater sense of authority within medical interventions if we have that spelled out ahead of time. So that's where I see a unifying ethic of love, loving the medical community, loving our families, loving ourselves.
Drew, I wholeheartedly agree with that. Love is such a unifying force, and that's what we need right now. Well, what do we do next? What do we do with that motivation?
We can fill out, there's some forms that we can fill out that give information to the medical community. And our doctor, Dr. Dunay here, can speak to those things. And we're going to go through those so we can at least provide you some information that you can utilize and help the community and your families.
Dr. Dunay, can you help us here?
Yeah, I'd be happy to. Hey, thanks so much. So Megan Dunay, I'm a board-certified geriatrician and family physician. I've had the great privilege of having a number of these goals of care conversations with patients and families who are facing serious illness, life-threatening or limiting illness, and just the consequences of aging in and of itself. So we live here in the state of Idaho, but every state in the nation has something similar or analogous to this. Here in Idaho, we have what's called a Physician Orders for Scope of Treatment form, or POST, P-O-S-T. Other states call it different things, but essentially this is a form where a patient and their family can fill this out with your physician. Most often your primary care provider is poised to sort of know you and your wishes and have this conversation with you and your family member the best. And the idea is that you can fill this out ahead of time, have your physician or provider sign it, and they're durable orders. So you can put them, a copy on your refrigerator at your home. You can take a copy with you to the hospital. Heaven forbid you need to show up in an emergency situation. But these are actual orders. They're signed orders. And so they tell our colleagues in EMS services or in emergency departments what you or your loved one would like for themselves. And I just, the ethic of loving yourself, loving your neighbor is so, it's so compelling and so rich in framing this conversation because this is true. So looking at just the Idaho form, when you think about how do you show love to yourself and your family, the medical community, well, it's by being clear about your preferences and your values. This is a way to communicate your values to your family and to your medical community so that your wishes are honored. This also gives you a lot of power and a lot of control over what happens to you or what would happen to you in the event that you couldn't speak for yourself. So let's just go through this real quick section by section. Here in Idaho, we have 4 sections of note on this post form. The first section stipulates a preference for CPR. So this is CPR that you've probably seen on television or movies. This is shocks, medications, breathing tubes, CPR, breathing machines, if your heart stops beating or if you stop breathing. This stipulates whether or not you would prefer that. You can also stipulate your preference for invasive medical interventions in Section B. So you can stipulate, on a range from comfort measures only, things that would help you stay comfortable and honor your dignity, all the way up to aggressive interventions like going into the ICU. Here in Idaho, Section C is probably the most specific, and this allows you to indicate whether you prefer very specific interventions like feeding tubes, IV fluids, antibiotics, or blood products. And the fourth section is the advanced directive portion. And so, as I mentioned, these are physician orders for the scope of treatment. But what Section D refers to are any other documentation or documents that you might have already completed with your family, with an attorney, that also stipulate your preferences for life-sustaining treatments, things that would potentially prolong your life in the event of a life-threatening emergency. So these would include like a living will or other advanced directive documentation. So again, this post form here in Idaho and throughout the United States really gives patients and their families control. In an emergency situation, if heaven forbid your heart were to stop beating or you were to stop breathing, and EMS was summoned or you were brought to a local emergency department, all medical providers would immediately begin CPR, which includes chest compressions, breathing, medications, shocks. It can be quite invasive. The more chronic medical conditions you have, the more birthdays you've had, the more years of life you've lived, the less likely it is that CPR will meaningfully prolong your life. And the more likely it is that it could actually be harmful insofar as, you may end up in a situation in an intensive care unit that may not have the potential to restore you to a quality of life that would be acceptable. So in emergency situations, it's really, really important for medical personnel to understand the extent of interventions that you would prefer, lest we do something that you wouldn't have wanted. The other couple things I want to talk about, I think I mentioned that the primary care provider is probably the best person to fill this out with you. Having a relationship with you, hopefully over months to years, can really make this conversation a little bit easier because they should know you and your family pretty well. It's a good place to start, your primary care provider's office. Most primary care providers at this, this day and age, and particularly in the time of COVID, have become pretty comfortable with these. It's also very much okay to ask for palliative care. So palliative care or hospice folks to kind of help talk through some of these decisions and questions. Once you have completed a post form, please share copies with your loved ones. Keep a copy in your house. Share a copy with your primary care doctor's office. The more widely disseminated, the more widely spread this information is, the more it can help you and your loved ones during this time. And I think I'll just kind of close by saying that, again, this ethic of loving yourself, loving your neighbors, in a time where so much is uncertain in the medical community, and during a time where we're all so conscious of resource limitation, this is such an important thing to do to empower yourself, right? Loving yourself, loving your neighbors by being clear in your wishes. And I'm so grateful to have been able to participate in this conversation. Thank you.
Thank you so much, Dr. Dunay. You speak to the medical field with the authority that Drew and I just don't have. We get to be a bridge in the gap between your world and the religious world, and hoping to bring those people together to encourage these conversations to happen. We want to take the guess game out. We don't want people to not know what our wishes are. And for us, if you have that conversation, decide, yes, I want life-sustaining measures, then great. You talked about it, and that's what you want. That makes us happy. If you don't want those, and you've made those wishes known, then awesome. We're thankful for that conversation and how it took place. There are some resources out there for you to be able to kind of give you an outline for these conversations to happen. The conversationproject.org is a great place. 5wishes.org is a great place. And even more specifically, the conversationproject.org /faith has a whole section for religious communities. When I started this conversation, I didn't know that that churches were already having this discussion. We're already encouraging people to make their advanced care planning wishes known. So it was encouraging to me that we are not inventing the wheel here for the first time, but this conversation's already been going. And I just want to thank whoever's watching this. We appreciate your time and your willingness to love people and love people well. So thank you for joining us.